Nicola. So like I said before, I've got some questions that group members had sent in. If I could just run through them, if that's all right, and then we'll get the answers off Nicola and Maeve, if that's okay.
And I think we've touched on a lot of them already, haven't we? So which is good.
I agree. But I will just ask them, so then it's on the recording, so that person knows. I took names as well. Just
exactly.
Give me 1 second. I'll bring them up. Right. Okay. So. Question 1 was, it was from somebody off Twitter and also one of our regular members, Edward and Ola from Twitter. I have a learning difficulty. Why are people with learning difficulties last for the vaccine? Answers, please.
And I thought this was a really good question, because we have to say, why are we going in the order that we're going? I want to reassure everyone that we're not last for the vaccine, but we're looking at lots of different things to have a think about who needs the vaccine first. So the government organised a big group of people, lots of experts, to look at all the research, all the studies, and their main goal is thinking, right, who needs the vaccine first, based on, sadly, who is most likely to die from coronavirus if they get it. Okay. And when they've looked at what's been happening all across the world, they've shown that actually people who are older are more likely to sadly die from coronavirus than young people on average. And so that's why at the top of the list, they've prioritized our oldest people to make sure that the people who are most likely to get poorly get the vaccine first. Now, there has been more information that's come out since then that I think we do need to take into consideration. So, it looks like lots of people were up to date with some of the studies that people with learning disabilities as a big group are sadly 3 to 6 more times more likely to have a very bad illness with coronavirus and even die from it. So here in the UK, there's been a big law group who have written to the government and said, hey, this isn't fair. We need to think about the needs of our learning disability population and how they can be prioritised. Some will already be prioritised if they live in a care home. We're giving some vaccine to people who live in care homes. And also if there's conditions like Down syndrome, or if anyone is shielding. So if anyone's been told by their doctor, you must stay at home as much as possible and only leave the house for hospital or GP appointments. So they would be prioritised too.
Thank you. Next one was from a parent, and she'd been told, or she'd heard, that she had to have the flu jab before she got the vaccine. Is that true? And they'd refused to give her the vaccine if she hadn't had the flu jab.
Yeah, so that's not true. So if there are things that are coming through about if we're worried that it might not be right, I'm more than happy to be contacted, and I'm always happy to talk to GPs or try and get an understanding of what's happened like there. You don't need to have had the flu vaccine to have had the to get the COVID vaccination. But it is a good idea to get the flu vaccine. So if you've not already had it, you can still get flu vaccines at the moment. But you can't have 2 different vaccinations in 1 week. Okay. So if you had a vaccine on Monday, a flu vaccine, you couldn't go for the COVID vaccine on a Wednesday, for example. So it's as long as you have that space, it's fine. And if you didn't have the flu vaccine, it's absolutely fine to have the COVID vaccine.
Thank you. Next question. People with learning disabilities are more than 6 times likely to die from coronavirus than the general population. People with Down syndrome and people with profound disabilities will receive the vaccine as a priority. But why are people with mild or moderate learning disabilities not higher on the priority list?
That's a really good question that we've been asking as well, haven't we, Nicola? And as I mentioned, there has been a big group of lawyers that have written to the government to challenge this. So, you know, any good scientist, any good politician, make sure that we keep on thinking about things, and if we need to change the plan, that we do change the plan. I think the government also want to keep the plan quite clear. So, you know, they don't want to change the plan too much for it to be confusing for people. So at the moment, the plan is still the same, but we have been reassured that if things need to be reviewed, then they will be. So it might change.
Thank you. Another question is, why are carers getting the jab before the people that they care for who live in the same home? Can they not vaccinate the whole household at one time?
So for these sort of things, it's always good to talk to the booking centre or your GP, if your GP is organising the vaccine, as to whether you can get more than one person done at a time. Because of the supply of vaccines that we get, you know, sometimes we don't get them delivered to us at the time we expect. And sometimes we do need to make changes about when we do different people. If we can plan ahead, it's always a good idea. So if your carer has been invited for a vaccine and you haven't, but you think you need one, then it's always good to talk to whoever's doing the booking for you to say, hey, could we get this done at the same time?
Thank you. Let me just get the next one. Sorry, there was another part to that question.
I'm just remembering.
Been offered a vaccine as they are over 70, but why haven't I?
Yeah, so we come back to that list, that kind of big to-do list that we've got in terms of who we can offer a vaccine to. And it can be a bit frustrating sometimes, because as GPs, you know, we can see, actually, we want to offer this other person a vaccine, but we're not allowed to yet. So always fine to ask. Okay. So if, you know, someone else in their household's been offered one and you think you need one as well, always fair to ask. But don't worry, you will be offered one as soon as we're usually allowed to offer you one as we go down that list.
Thank you. So I think the next three have been answered already. Is the vaccine safe? What is in the vaccine? And why do we have to wait 10 or 15 minutes? But I think we've already answered them, haven't we? So the next question is, what are some of the side effects? And when you say there could be severe side effects, what does that mean? And what could these be?
So the most common side effect for the vaccines that we use is a bit like the flu vaccine. So when you get that injection in the arm, it can feel a bit sore. So when it goes in, it's pretty fine, actually. People are like, oh, that's okay. But then once your body starts to go, hey, what's that? And starts to build that immune response, that can then make the arm a bit sore. And that typically lasts maybe a day or so, but can last 2 days. Some people, when their body's going, hey, what's that? And fighting back, it can give us a bit of a headache as well. Can make us feel a little bit flushed or even get some chills, and can make us a bit tired. But again, that's for 1 to 2 days, and it's really similar to the flu vaccine if you remember what the flu vaccine felt like. In terms of severe side effects, we're thinking about those severe allergic reactions that we talked about. So if you've had a history of a very bad allergic reaction that you had to go to hospital for, that we call anaphylaxis, that's when it's really important to let your doctor know, or whoever's giving the vaccine know, so they can watch you. And those would be the severe side effects that we'd be looking out for. But for most people, if they've never had a very bad allergic reaction, then that's not going to be a big worry.
Thank you.
Maeve, I'm just wondering if it's just worth referring back to what Rosie was saying before. So really important things that you can do after you've had the vaccine. So making sure you drink plenty, eat a good diet, and maybe just have a bit of a relax that day. So rather than doing lots of exercise and having a busy day, just have a nice relaxing day. And there is an option to take some paracetamol if you're feeling,
Yeah, exactly. So if you're okay to take paracetamol, then you can take that. If you've got a carer that helps you with medicines, just talk to them about that. And yeah, avoid doing many weights on the day, because then it'll make your arm even more sore. But other than that, you'll be fine.
I spend most of my time avoiding doing weights anyway.
Oh, well, there you go, Andy. So you'll be fine. I think Morgs is waving his hand.
Yeah,
or is he doing weights? Are you doing some nice bicep curls?
Imagine, yeah, if it's Christopher. Will there be home visits to give learning disabled people their vaccine jabs?
Yeah, so if you are the sort of person who has to stay in bed because you can't get out of bed, if you can't leave the house for your appointments normally, then we can offer home visits for our patients, and we're starting those quite soon for a lot of places. It's only going to be offered if you can't normally make your appointments, if that makes sense. And that's just so that we can make sure we get out to the people who need it the most.
So if you're unable to travel, I guess that would be, and you're at
Yeah.
home.
So if you're what we call housebound, so if you can't even get out to, before pandemic, if you couldn't leave the house to have a haircut or go for any appointments, if you have to have most of your care in the bed, then that's the sort of people we'd be thinking.
Thank you.
Maeve, I just wonder, because there's a group of people, isn't there, where maybe the vaccination, they can get out of the house and they can do things day to day, but actually going to a vaccination site is something that's going to be extremely difficult. So I think it's really important that you're letting, the person that rings you about booking your appointment, letting them know that that's something that's really difficult, and letting the learning disability team know if you need any support with that.
Yeah, exactly. And then we can make a plan based on your needs.
Yeah.
I'm just conscious there's a question in the thing from Nicola. So just so you're aware, Andy.
Yeah. So that question from Nikki is the second dose the same vaccination, and are the side effects worse?
They're very much the same. Yeah. So if your body's seen something before, then it can have a slightly stronger reaction and say, like I was saying, because your immune system's ready, it can go, hey, what's that? I don't like that. But when they've looked at in the studies, they haven't shown any big difference between the first and second doses. So if you're fine on the first dose, you should be grand on the second.
Sorry, Andy.
No, go on.
Oh, well, I was just going to ask a bit similar to your question, Ned. If somebody, as I'd say, like the Pfizer vaccination, but then they're given the Oxford one on the second one, would they do that, or?
We technically can do that, but we're avoiding doing that as much as possible. So we really only want to offer, the same vaccine if we can, just so that we can keep track of how everyone's been on different vaccines. So if you have a Pfizer one, I really dearly want another Pfizer one. You have an AstraZeneca, you have another AstraZeneca. But when they've drawn up the vaccines, technically we can. So if there was a big supply issue, if we struggled to get the vaccines we need, then there's a small chance they might offer, but probably not.
Right. And would the efficiency of combining the two jabs be just as good, or will there be?
You'd expect that it would just be as good if we think about actually how these vaccines work. But we've not looked at these in the big studies like we've looked at just using the Pfizer or the AstraZeneca. But if I think about the science and how it works, then it should be just as good. We'd rather know that it was backed up by lots and lots of research, though. So that's why we try and stick to one or the other.
Right. Okay. Thank you.
Next question from the list is, can you still catch COVID if you have had the vaccine?
Yeah, so no vaccine is 100%. Okay, so when they've looked at the Pfizer vaccine, they have looked at how many people get symptoms, and then we find that they've got COVID. And of the people who had their 2 doses of the vaccine, 95% were protected and didn't get any symptoms, and then were tested and didn't have the disease. The really good news is that of the people who had the vaccine, no one got very, very bad disease. So even in that small number of people who might still have caught something, none in the trials have got really bad illnesses. So that's really good news. That shows it's protective. With the AstraZeneca vaccine, they did the study in 2 different places. They did it here in the UK and in Brazil, and they got slightly different results. And we think that's because in the trial, they used slightly different doses. And that combined, that was about 90% effective. But we think actually in the real world, it might be a bit better because we think we might have got the dose just right. So the side effects aren't too bad, but the immune system still gives a really good response. And again, the really good news is that no one got any very severe, really bad illness from if they came into contact with coronavirus.
I think Jed's mum's got a follow-up question there. Is
that me?
Yes, yes.
Yeah, I was just wondering, when these are given at the vaccination centres, do they hold both injections, both types? Or is it just one? Jared's had his, and he's had the Pfizer 2 weeks ago. Quite annoyed because I actually phoned my doctor because Jared had questions he wanted answering to be told, no, you can't speak to your GP, which left Jed on a downward spiral, not knowing, and I couldn't answer the questions that he had. He's had the Pfizer, but I can't have that because I have anaphylactic shocks in the past. Do both does every centre hold both vaccines, or is it a different centre for different types of vaccines?
Yeah, so it hasn't been too simple. So we're relying on the supply that we can get. And sadly, we're not told with lots of notice what kind of vaccine we'll get. Based on what we've been having recently, we're more likely to be getting more of the Oxford or AstraZeneca vaccine coming up at our big vaccination centres. And for all of our care home patients, we're doing AstraZeneca vaccine because it's easier to move around. But sadly, we're not allowed to give people a choice unless there is a medical reason for it. Like yourself, you would need the AstraZeneca vaccine because we know about the small risk.
Will I be sent to a different site?
Yeah, it isn't as consistent as that, as annoyingly. We're kind of at the mercy of the supply that we're getting. I'm sorry to hear that Jed wasn't able to have that talk with his GP.
It was really, really hard.
Yeah, it's because it's big decision time, isn't it? And you want to be able to ask those questions.
He's sole carer. So when he goes on one, as I said, it's me that takes the backlash.
Yeah.
Constantly.
I hear you. Yeah, I hear you.
I wanted to ask my doctor at that time, was it possible that I could have the injection at the same time as Jared? I took Jared for his. But because there's only me and him, when I go for mine, he has to come with me.
Yes.
So it's like a double.
I know, and it's so tricky, isn't it? Now, we can't ever guarantee that one or the other will be at sites. We're probably just going to be getting more of the AstraZeneca at sites soon. And it's tough. GPs have been really overwhelmed. They're working really, really hard. And some GPs have to say, I'm really sorry, we can't take these questions now.
I think always there should be allowances for people with learning disabilities.
I agree.
Jared just wanted to know what to expect when he got in there. And sadly, I couldn't answer.
And so, you know, if anyone else is worried about being in this position going forward, you know, Manchester People First are fantastic advocates. They can contact myself, they can contact Nicola, so that if there's questions that we can't get answered by someone's GP, we can be forwarded to someone who can answer those questions. I think whenever it's kind of approaching the GP, I'm sure you already did, but it's really important to make clear that, you know, if you do have a learning disability and why you do need that extra time, because we, as any healthcare professionals, should be making those reasonable adjustments and giving that extra time to help people understand.
So was that, Adele?
Yeah, exactly. Thank you.
Was that just around what Jed would expect when he went to the centre to get?
Yeah. So Jed understood about the injection. The way I explained it to Jed was it's just like your flu jab.
Yeah.
That's it. Jed then couldn't understand, if it's just like the flu jab, why am I not going to my doctors?
Yes.
That's a fair question.
Yeah.
So, Adele,
So I even had to take him to the site the day before to allow him to process. But obviously we couldn't get any further than the car park.
Yeah.
And Jed wanted to know, when he went in there, how long he'd be in there and what the process was. And sadly, I couldn't get these questions answered.
Yeah, and that sounds so frustrating. And so just for everyone else to know that if anyone gets an invite to a certain place and they've got questions and not sure what to do, more than happy to be contacted. And Nicola and I are getting to know a lot of the sites around Manchester. And if we don't know the answer about a particular site, we'll be able to find someone that does. So
Can I ask a question?
Just 1 second, Sam. Just let's finish this off for Adele and Jed. That fits in perfectly to our last question and what Nicola was saying earlier on about we was calling that a jab journey. So what we'd expect, exactly like you said, Adele, when you turned up, what to expect.
He needs to process it.
Yeah. So we were looking at that and hopefully maybe working with Nicola around what each of the centres look like. So, Nicola, do you want to say a little bit about what we're calling the jab journey? And I know, Steve, it was mentioned at another meeting with Andy Burnham last week, wasn't it? So there is a lot of work being done around it. So should I just hand over to Nicola, because we spoke about it last week, didn't we?
Yeah. So each of the vaccination sites complete something called an inclusion assessment. So that's looking at all vulnerable groups and all needs and thinking about how we can make a patient journey better. So in response to kind of, what Jed and his mum have experienced, I think that is echoed, and that's really a common concern, isn't it, for people we support, so people with learning disabilities and their anxieties. So we've got some social stories, which I'll share via Andy in relation to some of the vaccination sites across Manchester, but we're hoping to have one in place for every vaccination site. So they've been done by the learning disability team in partnership with the key people that kind of operate that vaccination centre. So the walkarounds have been done with the learning disability champion, somebody from the vaccination site, and then also a person with a learning disability as well. So what I did say to Andy when I spoke to him last week is, if anybody on this call would like to be part of any of those walkarounds, then please let me know, because we want to get as many people as we can involved, and you'd be happy to visit a centre in your locality, then just let me know, and you can do that with the learning disability champion. Any kind of in terms of, it's really important that we understand some of the barriers that people are facing, and we can advocate that, but it's stronger if it's coming from you as a group of people, isn't it? An advocacy group.
I know that doesn't help Jed for it last week, but
I know, I'm sorry about that.
Forward for his next
I'm sure the reason why I said it is because I'm not going to be the only one that's put in this position. On this, I think it needs to be looked at. But for instance, Jed, who needs time to process and to be able to get the answers to his questions. And sadly, I could answer some, but I couldn't answer all of them.
Thank you. That's a great question, that, Adele. Sam, have you got a question? That's it for the written down ones, I think, because we've covered everything else. Sam, did you say that you had a question? Sorry to cut you off there.
Yeah, I had a question. I just wanted to ask, if you've had COVID, is it possible you can get it again or not?
Yeah, so sadly, there have been some cases where people get it again. It isn't very common to get it again, because a bit like how the vaccine gives you the vaccine helps your body develop immunity, give those antibodies. That same natural process happens if you have the COVID virus usually. But sadly, we have seen that it's rare, but some people can get it again, which is why it's extra important, like I mentioned, to get your COVID vaccination when you're invited, to make sure you've got that as good a protection as possible.
Are the symptoms a lot similar to when you first had it, or is it the worse?
So I've got two of my best friends had really bad COVID in about April of last year. And when they had their vaccination, they had the side effects, like they got a bit of a headache, they felt a bit tired for a day, but then they were absolutely fine. So if you've had COVID in the past, we think you might be slightly more likely to get the side effects. We're not sure, but we think they might be slightly. But they were absolutely fine. They were very mild, the symptoms they got.
Okay.
Thank you for that.
Does anybody have it? I'm just aware of the time now, and it's creeping up to 12:10. I'm sorry to get everyone. Does anybody? Thank you to Maeve and thank you to Nicola. If you do have any other questions and you're from Ordinary Lifestyles or anything like that, or Michelle, you want to follow up on anything, please?
Yeah, there's just one more. Can I just ask one more question?
Of course, yeah.
Just going back to the vaccination, right, on the 15th of January, I went and had my vaccination done at North Manchester Hospital. The next day, I got sent a text message saying, in line with the new national instructions, your second COVID vaccination appointment has been cancelled on the 5th of April. And we will be contacting you in due course, blah, blah, blah. Anyway, I ended up ringing up North Manchester Hospital yesterday because it was like a couple of weeks now down the line. So I thought, well, I'll check this out. Do you know they didn't have anything on their system? So she actually investigated it because it was me and the two members of staff, and she did get back to me. And she said, and they booked us now for a new appointment. But again, this is another one. If you don't, if you're receiving text messages and you're just waiting for them to contact you, they haven't contacted us. I had to contact them rather than them contact, because they didn't even have it on their system that these appointments have been cancelled.
I see. Okay. So the big national system that records everyone's coronavirus vaccine is something called Pinnacle. So there was a bit of confusion at first when people were so initially we were going to do certain vaccines 3 to 4 weeks after the first one. And then to make sure we could vaccinate as many people as possible, then you're probably aware we've changed that to 11 to 12 weeks now. The Pinnacle system should record when everyone's had it and then should go through everyone's to invite them back at the right time. But if you had your appointment cancelled, that has caused a little bit of confusion sometimes. But it will have been recorded on the Pinnacle system. They update your GP, and it might actually be your GP who invites you back for the next vaccine, because it's a couple of months away. There's going to be some of the details that are probably going to be worked out closer to the time in terms of whether you go back to a vaccination centre or whether your own GP could offer it to you at the right time. So don't worry, it will be in the record. There was just a little bit of confusion caused by at first changing some of those dates.
Well, they did change it, so it's now till the 8th. But do I have to go then back to, could I ring up and ask them to go to a different site, or would I still have to go to North Manchester? Because I live in Wythenshawe. So could I pick a different site?
So it depends on the booking system. So if the booking system covers more than one site, then you should be fine. I don't know about all the different booking systems, sorry. Right, okay. But otherwise, they'll probably have to get you back up to North Manchester, sorry. Yeah.
Right, okay. Thank you.
Thank you. So, does anybody have any burning questions? Like I said, if people from the Shaw Centre want to ask Nikki, and she could forward us them on. If people from Ordinary Lifestyles want to send them to Kathy, then they can forward me on. I won't be able to answer them. I'll forward it on to Maeve and Nicola, and then I will give you the answers back. Is that all right? But I think there's been some great questions, some really good things answered. Thank you, Maeve, and thank you, Nicola, for coming on. Sorry it's overran ever so slightly, but it obviously shows that people have got lots and lots of questions that they...
Really good questions today. Yeah, thank you.
Thank you very much, everyone. Okay, is that all right?
Brilliant.
Cheers for everyone joining us. I really appreciate it. Like I say,
Thank you very much.
questions.
Thank you.
Thank you for coming
Fantastic.
on.
So nice to see you guys.
Cheers,
Thanks,
mate.
Andrew.
Nicola,
Bye.
stop the recording.
Bye.
Bye-bye. Thank you.